So we have already seen what the different approaches of personality, like psychoanalytic approach that was given by Freud and those followers. And then comes the trait and type theories. We have covered many psychologists' point of view like in yesterday class. Then comes the humanitarian approach and behavioral approach. We have already know the behavioral approach in detail because we have read that in our AGP paper 1. Today we are going to talk about that in brief, and humanistic approach in little detail, and some assessment of personality test. There are many personality assessments are there. We have only few which has been given in our book. That alone we are going to cover up today. Okay, first we are going to talk about the learning approach or the behavioral approach. We all know like learning is a form of behavior modification will be happening depending upon what we are learning and depending upon how we are getting conditioned day by day. So our personality can be determined, modified, molded, and it can be evolved based on the learning purposes happening on day-to-day basis. We all know those learning approach and the learning theorist are the Pavlov, the Skinner's experiment, social learning by Albert Bandura. So about these three people only we are going to see today. So the learning is actually a sum of a learned response to an external environment. We always tend to learn through some things happening in our environment. Based on that, if it is a good behavior, we'll try to maintain it. If the consequences are bad, we are trying to avoid it or we are trying to minimize it. This is how the learning is helpful in modification of our personality or the behavior. Since learning is a learned one, we can also unlearn the thing if you really don't like the consequences of your behavior or the personality what you are showcasing on that particular time. So
Any PPT you are present, Subha?
no, there was no PPT for this because we have learnt all this already. Suganti ma'am has given a very good PPT for operant conditioning and social learning. No, that PPT we can use it because I'm going to talk about that one. That was the
Okay, thank you, Subha.
okay, yeah. So where were we? Yeah, we were talking about Skinner and Bandura's thing. So they were the humanistic, behavioristic people. They were talking about how personality can be modified based on the conditioning happening in a day-to-day basis. Conditioning is nothing but the learning happening on a day-to-day basis. Skinner strongly believes that personality development is a continuous process because as human we will be keep evolving day by day. We will be learning every day basis. So he was emphasizing that the personality development will be happening throughout our life. It is not like you will set up a personality and you will stop with that. No, it is not like that. The more you evolve, the more you refine, the more you tend to learn, or the more you condition yourself, your personality will be keep changing and it will be evolving for better. So he was talking about the operant conditioning. So the two main things of operant conditioning is the reinforcement and the punishment. When you want a behavior to come again and again, or when you wanted the behavior to long last, or you wanted to repeat the behavior, you will go with reinforcement. When you really don't want the behavior to expressed, you will be going with the process called punishment. So we have dealt a number of times regarding this reinforcement, positive, negative, and positive punishment and negative punishment. So we have seen almost a lot of time in so many discussions we have done. So straight away I'm going to move to social cognitive theory or the social learning theory, that is by Banduras. In social learning theory, it is like a commonly used theory and most used theory. We learn many things through observation. It doesn't have that you have to experience something, you have to do something, and then you have to learn from your own experience. Is not what has been advised by Bandura. By seeing something itself, you can learn. By that itself, you can modify your behavior and your personality. It doesn't mean that you have to go and touch a fire and have to understand it is hot. When someone says it is dangerous for you, you will never do that. You are learning through a social learning from your environment, from the people around you. So this is what has been emphasized in social learning by Bandura. So this he was talking about the social learning as a very very important and widely used way of learning rather than operant learning or the classical conditioning method. So this operant learning, it is like the action of others will mold you. You will tend to gain lot of insight from the experiments happening around you or the day-to-day happenings that is you're witnessing around you on a daily basis. The consequences of a behavior, it is all based on what you observe. When you observe the consequence as good, you will do that action. When you observe the consequence of the behavior is bad, you try to avoid that. This is what has been explained in the Bobodol experiment. The child which has been exposed to an bad consequence of a behavior, the child will not do the behavior. If the child experienced a good consequence of a behavior, the child will able to replicate the behavior. So the based on the consequences only, the behavior will be either you will bring it to no action, or you will stop it because of the consequences. So this was given by Bandura. Sorry. And we have seen in this experiment, that is Bobodol experiment, how the behavior can be learned by looking at the actions or the things happening around you. He was talking about two different things in social learning. One is self-efficacy and another one is reciprocal determinism. Self-efficacy is nothing but the belief system of oneself. What you believe has what you are. So based on that only, your behavior will be modified. If you think you're strong, if you think you're good, if you think you're genuine, if you think you're kind, those behaviors will be mostly predominant for you. If you have a very low self-esteem or a self-efficacy, you will see everything as a threat. You will not do that. You will not express that behavior. You will not be very confident. You don't have your own you do not know what you are capable of, so you will not try something new. You will not express your personality in a good way. So he was talking about this belief system, that is nothing but the self-efficacy. When you have a high self-efficacy, that is when you have a very high self-esteem, or when you know yourself, or when you believe that you can, then you will have a very good personal well-being. All your failures will be, those kind of person, how they look at the failures is, they'll see why I have failed in this. They'll try to collect those points and they wanted to correct it, so that the next time they want that failure to be turned as a positive thing. Whereas when you have a low self-esteem, how you will think is, you keep still doubt yourself that you are the responsible for your own failure, and you will never try to correct yourself because you are not having confidence on you that you can correct yourself. So these people will be unwilling to face some problems. They don't want to accept some challenges. They have very little levels of aspiration, and they are very weak to their commitments or their goals. And those people who have greater amount of self-efficacy or the belief system on yourself will have a very greater accomplishment in life, and they are less prone to stress and depression. Whereas who have self-doubt on themselves, they have more amount of stress, and they have prone to more amount of depression. So this is what he has been emphasizing on self-efficacy. So it is actually what you believe about yourself is what matters. This is what making you or pushing you to achieve something. That is how your personality will be molded, or the people from the outer world will perceive you as in that personality. So this was about self-efficacy. Next is what he was talking about is reciprocal determinism. So whatever happening in you,
But you add a water and
yeah, it is nearby. Thank you.
and take 2 minutes rest and again
And
we'll start. You will
so,
start.
thank you. Having
Uh, little bit you say in fast. So slow up பண்ணிட்டே இருந்தீங்கன்னா கொஞ்சம் அந்த கம்மியாகும். ரொம்ப
yeah,
வேகமா சொல்லவே
yeah, I'm having strepsils in my mouth. Also there. Thank you.
நம்ம கொஞ்சம் வேகமா சொல்லிட்டே இருந்தா
Ah,
மாதிரி பொறுமையா சொல்லுங்க. அதாவது
okay. I'm going too fast.
நேற்றை விட நீ கொஞ்சம் ஃபாஸ்டா இருக்கு.
No, these are all already we know, so I'm little fast in that since we all know this topic.
நீங்க சும்மா ஓவர் வியூ மட்டும் கொடுங்க, ரொம்ப டீப்பா வேணாம். இருந்தா சொல்லிடு.
Okay, fine. Okay, fine then. So the thing with what we are talking about was reciprocal determinism. So he was Albert Bandura was telling that the behavior has have to have three factors. So he was talking about a dynamic or the reciprocal interaction with the environment, the personal factors of you, and the behaviorism which is going to come out of it. So what he was telling the three factors as the person, that is me, the action, what I'm going to do, and because of that, how I'm going to have a reciprocation with my environment. So these three factors, what has been dealt in reciprocal determinism: the person, the action, and the interaction with the environment. See, if basically I'm a person, like if I really wanted to help other people, that is what I really want to do. Means what I'll do is I'll take a lot of measures to go and help others. So as a person, I really wanted to help. The action is I'm going out to the environment and helping others. The environmental thing is I will get inspired by people who help other people, or some people will get inspired by me when they are looking at me when I'm helping other people. So these interactions will be keep happening in our environment. This is what he was telling us, reciprocal determinism. So there is a give and take between the environment and the person, so by the behavior has been developed or the personality is getting modified. So this was the thing he was talking in reciprocal determinism. So these self-efficacy and reciprocal determinism, we have to give a small gist in social learning. With this, we are finishing the learning theories or the learning approach of personality. So we are talking about Skinner and social cognitive learning by Albert Bandura. And it was also like classical conditioning also comes under this, but only very few has been given in our textbook of semester 2. Next, we are going to humanistic theories. When we talk about humanistic theories, the main two persons are Maslow and Carl Rogers. So they comes into the picture. So when we talk about humanistic theory, it is the word itself suggests that human needs are more important. Only when it has been fulfilled, the personality will get well developed or the behavior will be developed. So this was the whole idea of humanistic approach. So you need to have basic goodness to be fulfilled, and your freedom of choice have been given importance. How you feel, what is your want, what is your need, how you really want you to be in a society, what are all the needs and wants you really wanted at that point of time, everything has to be what to say achieved. That only then you will get to know, we will get to develop a fulfilled personality, or a fulfilled character will be getting developed. This was the complete emphasis given in the humanistic approach. So when we talk about Carl Rogers, again we have read the Carl Rogers self theory in TCP paper in first semester. He talks about two things. It is the self image, the ideal self, and the real self. See, the real self is how am I right now, or how am I today. The ideal self is what I wanted to become or how I wanted to become. So always there will be two self in you. So what you are today and what you want to become. What you are today is the real self, and what you wanted to be, it is the ideal self. When these two things have a greater amount of matches, that state is called congruent state. You don't have so much of gap between the real self and the ideal self. It is called as congruent state. You are more congruent, there is no much gap. You can be the ideal self within a shorter span of time when you have a very little gap between the real and the ideal. When you have a lot of gap between the real self and the ideal self, that state is called incongruence. You have long more way of journey to reach the ideal self, so it is not getting matched. So this is called as incongruent state. So he basically talk about the real self and ideal self. When there is less gap between real and the ideal, it is called congruency. The self matches are equally with the ideal, whereas in the incongruent state, the gap or the journey of your real self to achieve the ideal self will be little longer. So this was the theory which has been given by Roger. When you have a very small gap, you will be highly what to say, you will be highly happy, you will be contained, you don't have any maladaptive behavior, you really feel good about yourself. So this is what is called self theory. How you feel yourself, how you make yourself more happy, how you make yourself more fulfilled individual in a society. This is what has been emphasized by Carl Rogers. He was also talking about the as a self, the development of self is the central construct, is the key element. How you develop yourself by achieving your ideal self is the key concept in Carl Rogers theory. So this was the first humanistic approach given by Carl Rogers. Next comes our Maslow. So whenever we talk about Maslow, I think in last semester we got this hierarchy question as one of the questions in, I don't know which paper, but we got it. Maybe it might be AGP. This Maslow, whenever we talk about Maslow, we have to think the pyramid shape. I think you all have seen it based on the needs. This Maslow, what he was trying to tell is lower orders of the pyramid, or the lower orders of the hierarchy have to be fulfilled, only then we can go. See, when you have a problem with your food and shelter, you cannot think about your psychosocial needs or self-actualization needs. When you're struggling for your food, you will think only about food. You will not think about what others will do, whether other person has got the food, whether you got love and empathy from other people. That and all will not come to your mind. The basic needs have to be fulfilled first, then comes your psychological needs, then comes your self-actualization needs. This was the pyramid that hierarchy has been. So human needs determines the personality. That was the main emphasis given by Maslow. Whatever your need will determine your personality. When you finish accomplishing the basic needs, then you go to a psychological needs. Once you finish accomplishing, when you get all the psychological needs like love, care and warmth and recognition and appreciation from the society, you go for a self need, that is your self-esteem, building up your self-esteem, and last comes your self-actualization. So this is how the hierarchy, from the bottom you have to keep achieving the goals from bottom to top. Actually, in some of the Maslow's hierarchy, they'll also talk about a term called Transcendence. That is nothing but unity in the unit. You are united with the world. That is the highermost level. In mostly in Maslow's hierarchy, it not has been included, but recently they have included this state called Transcendence. It is oneness with the world. You have become the universe. You have become that is like more of a spiritual awakening. You won't feel you as you are one among the universe. You are also a part of universe. That will come only after self actualization point of view. But these actualizations and self esteem to achieve itself is a very greater thing. So this transcendence level is more difficult for us to achieve. So he was talking about the hierarchy, how it need to be fulfilled, how human needs determines the personality of an individual. This was the thought given by Maslow. Yeah, this was the thing which has been given by Maslow. So with this, we are finishing the humanistic approach also. We were talking about two people. One is Carl Rogers. He was talking about the ideal self and the real self. And next is Maslow's approach. He was talking about the hierarchy, where the basic needs, psychological needs, and self-actualization needs have to be fulfilled from bottom to top. Not like you can skip one level and you cannot go and achieve the other level. So he was talking about this. Next, we are going to see about assessment of personality. In our book, they have given very little. There are so many assessments, and they have grouped this assessment of personality into three categories in our book. One is paper pencil test, the other one is projective test, and the last one is behavior assessment. We always have there are various personality psychological testing tests are there, but in all these tests, never the test says you are right, you are wrong. It always gives the grade. It always have the extremes. It is more like a semantic way of questioning, or they will say yes or no, true or false, or the extremes. Like yesterday we were talking about a 16 factor psychological factor personality factor test. No, it is also got extremes from 7 ranges, starting from 0 to 7, those 16 factors. It is all coming under this. This has been given very brief in our book. I'm going to say very brief details about these tests. It will be very interesting if you go and read in detail. We will be reading this in detail in a psychological testing paper. That is a practical paper. You got lot of inventory test in it. You have got lot of batteries in it. We can read in detail when we are talking about psychological testing paper. So straight away we are going to this assessment of personality. Where and all they'll do this assessment of personality is when you go for any job. In giving you a job, during your interview, they will conduct a personality test. In some psychological disorders, to find out what category of psychological disorder we have, those clinical psychologists or the rehabilitation psychologist or the psychiatrist will do this test. It has been also used in guidance and counseling purpose. Based on the test results, what kind of problem they have, how we need to how we need to fabricate or modify the approach we have to give for that kind of problem. So in guidance purpose and also in counseling purpose, we use this test for modifying our way of treatment. The first thing is paper and pencil test. It is like more of a self report inventory. So this will come under a self report inventory. That is nothing but you answer about yourself. No one can know better than us. I know better about me than anyone else. It is like that. Self report means no one can know you better than you. But this thing will be contradicted finally. I'll come to that point when I say that. So self-report inventory test. This test will have a yes or no format or a true or a false format, or will have a multiple choice questions as a format. In that we were talking about self monetary scale. In the self monetary scale, a person will be given a lot of questions. In that you have to say true or false. It is hard for me to adjust to a new environment. It is hard for me to adjust to a new office setup, like that. So many different questions will be given. You have to pick the statement is true or false, or yes or no, or sometimes they'll give multiple choice questions also. You have to choose what suits you best. But whenever you are answering this, you have to be highly genuine, and you have to really say what you are really, not like socially acceptable standard answers are not supposed to be given. That will be the drawback of the test when we are going to talk about the drawbacks. So this is how a self monetary scale will be. When you have a high score in your self monetary scale, you are highly adaptable, you are highly adjustable person. When you have a very low scale or a very low score in your self monetary scale, you will have lot of problems in adjustment, but you will have a commitment to your routine. You will have one commitment of your behavior. You will have a set of behavior which you really wanted to stick on to, and you don't wanted to expose yourself or to experience or to explorate yourself. So that is what a low score of self monetary scale indicates. Next, what has been given our book is Minnesota Multiphasic Personality Inventory, MMPI. This has been a widely used multi-trait scale. So this has been widely used till now, even though it has got a lot of negatives and weaknesses. It was developed by Hathaway and McKinley, and it was also revised by Graham in 1990s. So this was usually used for diagnosis of psychological disorders, whereas the first one, self-monetary scale, it is not meant for a diseased population. It was given for normal population also, but this MMPA is mostly meant for diagnosing what psychological disorders the person is having. It is more of a clinical basis than to a normal population. It is actually very lengthy test. It has got so many items and statements in it. Again, it is like true or false, or I cannot say, or there will be a no mid-range answers will be given. This in MMPI, they have 14 subscales. As I said, it has got 567 statements in it. It has got 14 subscales. In 14 subscales, they are dividing 10 subscales and 4 subscales. These 4 subscales are to understand the validity of the test. That is, to understand how the person is answering, whether the person is really giving genuine answer, he is not deceptive with your words, is he careless attending the test, is he really changing these informations and the answers given in the test. So these are the 4 tests are basically to find out or to analyze the validity of the person who is answering the test. And the remaining 10 are clinical scales. These scales will measure different psychological disorders what the patient or the person is having. Those 10 subscales are used to diagnose, is there any body problem, or is there any schizophrenia problem, or an hypomaniac problem, is there any other psychopathology deviation, what about the depression level. So they were talking about the 10 subscales and they have given the name in our book. I'll just read out. If you go and read it in the book, you can able to keep that in your memory. Hypochondriasis, schizophrenia scale, hypomania scale, psychopathic deviate, psychesthesia, depression, hysteria, masculine femininity scale, paranoia scale, and social introversion scale. I'll send the whatever pictures or whatever materials I'll collect in WhatsApp, because I haven't done anything for the preparation, because I was having very little time. So I didn't prepare any slides or any PPT, but I'll try to collect the format of the scales and I'll forward that in our group. So this was about the MMPI test. So basically, what we have to remember is it is a widely used test and it has been mainly used for diagnosis of psychological disorders. And the test has got 14 subscales with 567 statements in it. And the test format is true or false or yes or no statement format. In this, the 14 subscales, 10 is for finding out what kind of psychological disorder you have. Other 4 is for to check the validity of the test. So this is about the MMPI. Next, we are moving to 16 factor personality test, like what we have seen yesterday. Those 16 factors I've shown, the warmth of the person, the genuineness of the person, those 16 scale I've shown yesterday, with low score and high score. That has been given again over here. It has got 187 items in it with 16 basic dimensions. We remember like sorry, I forgot the person name. 1 minute. Raymond Cattell. He was the person who has designed the 16-factor personality questionnaire, and in that, from 14,000 to some hundreds, he has cut shorted, and then he came to 160, 16 basic dimension with 187 items in it. It helps to assess the normal aspect of personality. It is not meant for diseased population. It is also meant for normal population, like the first scale we spoke about. This scale tells about what is the extreme problem, or what is the extreme personality thing we have. So that was been diagnosed with this. It is useful for the in personal and vocational counseling, when you're seeing for any job purpose, or when you're giving any other what to say, personal, you are assessing a individual on a personal basis, like a psychologist who does it. For that, this 16 factor scale is useful. Next, we are going to talk about the strength and weaknesses of self-regulatory inventory. Why it is called self-regulatory inventory? As I said, you are going to answer on your own. It is not like other people is going to study based on your actions or your way of behavior. You are going to answer what comes to your mind. So it is called self-regulatory inventory. The strength of the scale, the strength of these type of subjective tests is it has been highly standard and it has been used with established norms. So whenever you take, every person will be dealt with the same. It has got a proper question, and you will be having only 3 categories of answer, or a scale of answer where it ranges from low scale to high scale. So it has been very standard, and same questions and same instructions will be given for every individual who takes the test, and the scores will be quantitatively measured, and it can be analyzed and compared with the previous scales. So it is highly what to say, these are the strengths. So it is highly recommended for a quantitative measurement. And but the weakness or the demerits of the scale is it is highly subjective. You may not answer it properly. You can fake a response. You can say, you may really wanted to say true, but you will feel like whether it is socially accepted answer or not, what the other person will think. So you may fake your response and say false. So it is highly tedious also. That is another drawback. You got lot of inventories, lot of statements in it. So it is highly draining and it is highly tedious for you to finish those answers. So that is the another demerit of self-regulatory inventory. Next is you may lose interest when you're answering like 500 questions or 300 questions. After a point of time, you don't even read it properly and give your valid answer. So it is a time consuming, and it is also a draining in nature when you are finishing this test. And the last thing is you can deny your feeling and give a socially accepted answer. As I previously said, for faking response, you will deny your actual feel, and you can really fake your responses. So these are the demerits of self-regulatory inventory scales. The next category of the assessment of personalities, projective test. In projective test, they are talking about three things together. One is Rorschach. This projective test is a highly interesting topic. If we get another chance, we will discuss in detail with with this questionnaire. If we get it, we'll take a printout. We can do on our own within our home, and we can actually do a lot of experiment with this. This projective test is how you project your emotions, how you project your feelings, or how you project your inner state based on the questions they are giving. That is why it has got a name called projective test. It has indirect approach for assessment of your personality or your behavior. Your responses will be vague because you cannot quantify the score results here. It is only a qualitative and a descriptive answer, so you cannot quantify your scores. So it is highly vague, and it is less reliable and less valid compared with the objective test, or the subjective test what we have mentioned before. But this test provide lot of space and lot of working space for you to understand a person's inner thoughts, their feelings, their way of approaching any problems or situations. The first test in projective test is Rorschach ink blot test. If you have been exposed to that, you all know, like in our childhood days also, we take a paper, we'll spill some ink, we'll fold into so many foldings, and when we open, we see different images. One can perceive animal, one can perceive a human, and lot of optical illusion test we are seeing. No, it is more like that. What you perceive, what imagination is letting you to perceive what you really wanted to. So that actually says about your inner self. So it is like commonly used perception test. In this, ink blots are analyzed. You got 10 blot cards. They'll show you 10 blot cards. In each of the blot cards, they will use a black ink, red ink, or a multicolor ink. They'll take the responses and record it and score it, and they will analyze with the same age group of your category or with the previous results they have been already stored. So they'll compare that results and they'll give the perception or analyzing your personality or your behavior at that point of time. That is how the test will be performed. It will be what are the three things they will look mainly in this is the location where you are seeing the picture. Are you looking at the entire ink blot or only a part of the ink blot? That will be taken into consideration. Next is determinants of the picture. That is the color of the ink, the texture of the ink, the shape of the object, everything. Are you taking all determinants into your consideration while answering, or only one you're picking up and answering only that? So the location of the pictures or the location of your perception, determinants of your perception. Next is the content, what you actually see in it, in that ink blot paper, what you actually see. Are you seeing an animal? Are you seeing a cloud? Are you seeing a human? Are you seeing a forest? Are you seeing something else? So what the content you are actually seeing in it will be taken into consideration. So three things to be taken into consideration. One, the location, next the determinant, and the content of the picture. All three things will be considered when analyzing the personality or behavior of an individual while using this test. The result will be based on that, what they'll do, they'll confirm your personality as a very defensive personality, or an open-minded people, or you're an extrovert, or a competitive people, or you are comprehensive, highly adaptable, or also many categories they are having. They will category you into one such category based on the responses you are going to give with the ink blot test. The next thing is called thematic perception test. Shortly, we can call it as TAT. This was developed by Henry Murray, and he also uses numerous cards with pictures. It was the first test was ink blot. You don't have a proper picture for it. But in the thematic perception test, you got a very defined pictures, and it has got two versions. It has got a Western version, and it has also got an Indian version. In Indian version, they'll show a picture like a baby with a violin. So many pictures. When you Google this, you will get to see all those Indian version of pictures. I've seen it already when I'm reading it, but I couldn't show you because of shortness of time. If you go through it, it'll be useful. So a lady holding a baby, so many different pictures will be shown, and all these pictures will be black, white, or in gray color. No colors will be there in TAT. So based on the cards, you will ask to say or create a story. So when they show a card, a baby sitting with the violin in front, what do you see in that? Why the baby is sitting like that? What might be the reason why the baby has to sit like that? So they will ask you questions in such a way. So you will describe what's happening at the moment. I looking at the picture. What is happening at the moment? Second thing is what has led to the this kind of behavior or the expression of the person in that picture. The third thing is what are the characters you are thinking affecting at the moment in the picture. And finally, how you are going to end up the story. You have to really create a story with your characters and the intentions of all the characters and the behavior of those characters, and how finally you're going to finish the story. So this is what thematic perception test is dealing with. So based on the story, they'll ask you to be as imaginative as possible, and they will note down the time taken for you to how you're analyzing what how much time you're taking for analyzing the picture, and finally how much time you're taking for concluding the story, how much time you're taking for some questions if they ask in between, why the baby is like that, why the child is crying, why the man is running like that. If they ask some questions out of your story, how long you're taking for you to answer that question, that time also will be noted. So basically the time taken will be noted, and how you're cooking up the story or how imaginative and storytelling will be noted, and these two things will be noted in the TAT test. By listening to your story, they'll come to a conclusion of your underlying conflicts or the problems, or what motives, or what are the feelings, or what you're thinking in your mind, because unconsciously whatever happening in your mind, you will connect to the picture. You what your mind doesn't know, your eyes will not see. It is a Chinese proverb. If your mind doesn't know, your eyes will not see. So it is you can correlate that proverb over here. Whatever happening inside you, that only will come as a story, when someone is asked. So it is mostly used in relationship problems, for a marriage counseling, or with any other interpersonal relationship problems, means they can use this kind of test for analyzing what might be the personality problem, or what might be the feelings, or the trouble you are having at that moment. This is what is about TAT. Finally, we are going to move to sentence completion test. From the name itself, it is highly explanatory. You have to complete a sentence. So it is one incomplete sentence will be given to you, like I am, what to say, I'm very strong, dash they'll give. You can fill whatever you want. I'm so kind, dash. He is so genuine, dash. So many, any sentence will be given for you with a dash in it. It is an incomplete sentence. You have to fill the sentence. The intention of this test is to again to get your feelings unconsciously related to your mind state at that moment. Again, when we come to the, this is what they have been given in sentence completion test. When we see the strength and weakness of the test, the strength will be it assesses lot of emotional disturbances of an individual. It has got a wide scope of learning of how a personal problems you are dealing with right at that moment. Next is it has give lot of qualitative information than a quantitative information. The wealth of qualitative information through projection test is way more high when compared to self inventory tests. And it also things talk about or informations about psychological functioning of your mind. So it is based mostly on your imaginative and inner feelings, no? So it will talk more about your psychological feeling. So these are all the strength of this projective test. When it comes to weakness of the test, what can be weaknesses? You can the examiner or the situation or the present scenario on that time will influence the response of the person. You may get disturbed or you may get influenced by the examiner or the society or the environment or the people around you. Anything can influence you by that time. If you're continuously saying a story, you are getting a disturbance, that flow will get disturbed like that. So many external environmental influences will affect your performance. That is one weakness. Second is scoring is highly subjective. See, when I am conducting a test on you, other person is also conducting a test on you. I may give a different result, he may give a different result, because it is subjective for me. We don't have any quantitative analysis over here. It is only qualitative. So I perceive from what I know, I perceive from what my past experiences, like that the other person do with his or her own past experiences. So you cannot have a same score when you are doing the test at the same time even you are doing it with two other peoples. So you cannot depend on rely on much of a score basis. So scoring is highly subjective. That is the other weakness. And the next thing is it is poor in predicting the future behavior. Right now, what is your mental field? Right now, what is your psychological aspect? That alone can be analyzed or diagnosed with these kind of tests. But the future behavior, how you will be, of course, every other test will not do that. But there are some other tests like personality factor test or self-inventory test. The questions are fabricated in such a way it will be given the same response in future also. But in this kind of, when you have a psychological disorder, you will not perform the same way when you're future. So it is difficult for us to diagnose the future behavior. But even though it has a lot of demerits, these tests are highly having a popularity, and it is still in practice with lot of clinical aspect, and lot of clinical psychologists and rehabilitation psychologists and psychiatrists still use these types of projective tests to understand, because it gives a wealthy knowledge about your psychological state of mind. So still it is so popular and it's in use. So with that, we are concluding our chapter 13. In that, we have seen the humanistic approach, learning approach, and assessment of personality. With that, we are coming to the end of the session. Do you have any doubts?
சுபா, நேத்து புக்ஸ் நேம் அனுப்புறீங்க.
Sorry, Kalai. I'll do it today, Kalai. Sorry, Kalai.
Hello.
Mm.
Hello, கேக்குதா சுபா?
I'll do today, Kalai. Sorry, ma. I didn't.